Hello everybody, hi family, welcome again to Amazing Growth. This is Antoinette Hunter. I am a teacher and a developmental intervention specialist. I work with children on a daily basis. I work with kids out of the field, which is clinical, and I also work with children in the classroom. On this channel, I am going to be giving techniques and strategies on working with children with disabilities and developmental delays. So if this is your first time watching my video, you are very welcome, and please share and like. Your support is very important. I just want to say thank you to all my supporters today. On today's video, I am going to be discussing about speech and a sign of autism. The question is, late speech a sign of autism, and how speech delay differs in autism. So those are some of the things we're going to be talking about. Now, speech delay is very common among children with autism, but they are also common in children without autism. So we have to keep in mind that just because a child has speech delay or a speech delay does not really mean that they have autism. There are, however, very real differences between speech delays in autism and other types of delays. Now, in many cases, these differences are noticeable even to a known expert. Sometimes the symptoms can be very strong that even a known expert can take note that that child is struggling with a condition. So significant speech delays are always a cause for a concern, but they are by no means always a sign of autism. So don't be alarmed that your child is not talking, your child is not saying a lot of words, and compare them with other children and just draw the conclusion that your child have autism. That's not the case. We have to understand that as most babies develop, they quickly learn that communication is the key to getting what they want. Meaning communication is the key to getting their wants and need, long before they even learn to use spoken language. So little ones make eye contact, pull on sleeves, babble, point, and otherwise work hard to get their points across to adults and older children, or even their peers around them, because they have learned the power of communication. Over time, the majority of children learn to use spoken language because they get positive results from doing so. In addition, most children are highly motivated by social responses such as smiles and hugs. You know, babies, they love to see that smile and hugs, and they'll respond to that. Kids are also naturally inclined to imitate actions of people around them. So they watch everything that we do, and they want and they like to imitate. And kids are also likely to spend much more time observing people than observing things. So we want to keep that in mind. Kids also tend to be social beings who become quickly bored or lonely when left alone. You know, they don't want to be left alone. They are very sensitive to being alone. Most of the children are. We're going to talk about children with autism, however, may have social communications challenges that make social connection more difficult. So they're not going to communicate, engage in play, and function in a regular environment easily. It becomes a little more difficult for them. While children with mild autism may be much more socially inclined than those with more severe autism, the same issue holds true across the spectrum. For example, a child with autism may be more motivated by his or her own interests than by social responses. They may be rarely or never imitate others' actions. They are more interested in things than people. They are content when left alone to pursue their own interests. They don't want to be bothered. They're fine. They don't want any kind of disruptions. They like to play by themselves. For them, it's okay. All of these characteristics leads to different behaviors, desires, and outcome. So the next thing I'm going to give you guys is 5 speech-related signs of autism. If you see those related signs, you want to make sure you seek help from your doctor, or you consult your doctor. The first one, which I've seen very common, is the slow response to names being called. If you call their name, they respond very slowly. Delayed or absence of gestures like pointing is the second one. The third is slow rate of language development. Their language development is slow. The fourth one is sign of echolalia, or repeated word or phrases. They repeat the same thing over and over again. The fifth one is mostly speaking in single words. So they just speak in single words and respond in single words. I hope this video helps. If you're having any difficulties, or you're having doubt, or you feel that some of the things listed are things you should be concerned about, I would encourage you to talk to your your doctor, your child's doctor, or healthcare professional, to see how you can get help, so you can get the right services in place. Thank you guys so much for watching, and I'll see you next time with another series of autism and developmental delays.